Hey, welcome back to the channel. Today, we're going to go over some possible solutions for your TMJ issues. That's basically pain or tightness with your jaw. Now, TMJ issues are way more common than you would think, but it's also a very overlooked body area. I think that people are very familiar with solutions, or they've tried different things for their ankles, their knees, their hips, their shoulders. But when it comes to the jaw, I think that people just have no idea what to do because you just don't see many solutions out there and you don't get a lot of education on what to do for the jaw. So I'm going to change that for you today, and I'm going to teach you some of my highest payoff and favorite exercises that will hopefully help you with your TMJ issues. Are you ready? Let's do it. All right, before we get into the 3 exercises that I'm going to demonstrate and teach you, we need some kind of baseline assessment so that you can gauge what your body's response is after each drill. That's really the goal, because you don't want to take my word for it that this is the perfect protocol for you, because really, there's no such thing as a protocol. These exercises have worked really good for people in the past, but they don't work perfectly for everybody, and there might be just one exercise in this group that's super high payoff for you. In a perfect world, all 3 of them will be good, but it doesn't always work like that because each person is different, and we really have to respect that. So we need an assessment, and you're going to use that assessment both before the drill and after each drill to see how your brain and your nervous system are perceiving what you're doing. We're going to keep it really simple. Just open and close your mouth and kind of get an idea for how far you've moved. Qualitatively, how does it feel? Do you have any pain and any tension? And once you kind of understand where you're at in the moment, that's your baseline assessment. And what you will do is you'll do your baseline assessment, and then you'll perform a drill, and then immediately after performing the drill, you go back to your assessment to see better, same, or worse. And what we're ultimately trying to do here is identify which exercises are highest payoff for you. That means that your range of motion might improve. The tension and the pain that you feel might actually decrease. In that process, you might also discover that an exercise is not really agreeing with your body. For whatever reason, your brain is finding it threatening. And that information is actually just as useful as finding something high payoff, because we don't really want to practice the drills that cause threat and regress you. If it regresses you, that means that your range of motion might actually decrease, and you might actually feel increased tension or pain. Those are the drills we're not going to worry about. So as we kind of hunt through these different exercises that I'm going to show you, use your assessment process to guide you so that you can locate those high payoff drills, and those would be the ones that you want to practice. Now here's one last tip. Your jaw is very much connected to your body's posture and alignment. So there might actually be bonus results that you get, and you'll know that you get them if you know enough to check in with your body. So for example, your jaw can really help with neck issues. It can help with shoulder issues, hip issues, and even low back issues. So don't be afraid to use other forms of range of motion testing, whether you want to check on some shoulder movements, some neck movements, maybe forward bending to check on your lower back. You'll be really surprised how working on your jaw can have some really global effects on your whole body. This first exercise is basically a stretch for your jaw, but I hesitate to call it a stretch because most people associate stretching with forcing range of motion and even causing pain, and we don't want to do that. So let's call it a mobilization for the jaw, and it's going to be very, very gentle. So when you feel the stretch intensity during the exercise, keep it super gentle. A 3 out of 10 is a good rule of thumb. Basically what I tell people is whatever you want to do, do it with less intensity, and you'll probably be in good shape. This is an interesting exercise because really what this is called is a distraction of the jaw. And what that means is we're going to be using some kind of outside force to create leverage in a way that encourages more range of motion and more space in the joint. We're just going to do it very gently. The way we're going to create that leverage or resistance is by using our hands. And it's really, really simple to do, but just to warn you, it looks ridiculous. Try to do this in the mirror and watch yourself and not laugh. Take your hands, and you're basically going to put them together like this with your thumbs facing up. And the idea is you're basically going to take your hands and you're going to cradle your jaw. Okay, so literally just across the jawline, I'm placing my hands. Now, in the past, I've called this the Pac-Man stretch. You'll kind of understand why if you can imagine the Pac-Man opening up his mouth. It's like the top portion of the head and jaw is opening, but the bottom portion stays stationary. That's basically what we're going to do. Your hands are going to hold your jaw stationary, and you want to make sure that you're lengthening up and you're just kind of packing your chin a little bit. In other words, you don't want to do this in this position. So we lengthen up, we pack the chin a little bit, almost like you're going to attempt to make a double chin, but it's not super aggressive. And then you take your hands, you cradle, you still lengthen up, and now the idea is to open your jaw, and you're going to pin it in place so that it doesn't go any further and you can't move it. Once you have your jaw, or think about this as your bottom teeth, secured, you're not going to let them go anywhere, and you're going to take your eyes and your top teeth and you're going to go up. Okay, watch what it looks like. So, get everything secured, open. Okay, I told you it looked ridiculous. You're looking up, you're opening, think about Pac-Man, right? Opening the top, securing the bottom. And when you do that and you get to end range, again, keep it gentle, you will actually feel a bit of a stretch through your jaw. So let me show you from the side. Lengthen up, take your hands, get into position. So I'm going to open, secure. And when I secure, by the way, I'm sort of pushing in with my hands and down. Okay, and that's really going to kind of fix my bottom teeth or the jawline in place. And that's it. Very simple. What happened there for me is I held it for a little bit and then things kind of relaxed that I was able to go a little bit further. You may have seen me sort of reposition a little bit. That's because sometimes as you're going into the movement, you'll realize that you can do a little bit better job at pushing your hands in and down to secure your jaw. And when you do this, it doesn't have to be something that you do for a really long period of time, especially at first, because you'll be amazed at how intense this can feel. Go gently and maybe start with only like a 5-second hold, and that's perfectly sufficient. As you get comfortable with it and you gauge the intensity properly, you can then start to increase the duration, right, the length of time that you hold the stretch. Really what I find is that there's no need to do this for more than 15 to 20 seconds. 20 seconds would be a long hold. So what I personally do is I enjoy doing a few sets of shorter holds, probably for around 10 seconds. So that's the jaw stretch. This is what we're going to start with to kind of get things opened and mobilized and ready for what we're going to do next. This next exercise is a really, really interesting one and a very powerful drill. It's called a trigeminal nerve glide. So what we're going to be doing is putting tension, very gentle tension, on the trigeminal nerve, and then we'll move some different areas to mobilize that nerve. So the way this works is we go through a sequence of movements, and we have to secure the sequence. So it's fairly technical to hold all those positions. So I'm going to go through each of the positions to show you the sequence, and then we'll put it all together. Now, one thing that you want to be thinking about is whether or not you have one-sided issues here. Some people will complain about more tension or more pain, say on the right side or maybe the left side. If you happen to have more of a one-sided issue, that could come into play here because we have both a right trigeminal nerve and a left trigeminal nerve, and perhaps mobilizing one or the other is exactly what you will want to do for the best result. The way that you're going to know which side is best for you is by simply assessing, like I talked about at the beginning of the video, before and after to see how your brain, your nervous system, and your body is responding to the input that we're providing it, which in this case is the trigeminal nerve glide. So here we go. What you're going to do is lengthen up nice and tall. And the first movement of the sequence is upper cervical flexion. And so what that means is you're going to pack your chin and basically tuck it as if you're trying to make a double chin. Imagine that you have like a tennis ball and you're squishing it between your chin and your chest. That motion right there is upper cervical flexion, and that is probably the most important part of the entire sequence. It's also the hardest part of the sequence for people to hold. Okay, so step one is upper cervical flexion, and you're going to hold it. Once you have that secured, let's begin on the right side. Okay, from here I'm now going to laterally tilt my upper cervical spine. That's my neck, and this is also very critical. A lot of times people mess this up because they do a whole neck movement, meaning they're bending their whole neck like ear to shoulder. And that does not do the same thing. It doesn't put the tension in the area that we're trying to put the tension. So watch how strict this movement is. When I laterally flex, it's basically my head on top of my neck versus my whole neck bending. That is hypercritical in order to get tension on this particular nerve. Okay, so now we have two movements for the sequence. One, upper cervical flexion. Two, upper cervical lateral flexion, hold. Okay, finally, we're going to take the jaw. Now you're going to take your jaw and you're going to glide it away from the target side. So we're targeting the right side, right trigeminal nerve. I'm going to take my bottom teeth, I'm going to glide them to my left. And now I'm holding all three positions. And the last part is a full cervical flexion. Okay? So we put all that together. Once we're in the position for tensioning the nerve, we have multiple different options for what we call driving the mobilization. We can move our head and neck. We can even move our jaw. Okay? So let's do this again. I'm going to go back into the position. It gets kind of hard to talk as I'm in the position. And the first driver that you're going to see me use is going to be the upper cervical spine. Once I'm into the position, I'm going to create little nodding motions with my head. Really small ones, very subtle. And that's going to potentially mobilize this nerve. And I need to make sure that I keep all the pieces of the sequence in place, right, at end range of motion while I do the nodding. So here we go. Lengthen up. Step one, upper cervical. Step two, lateral flexion of the upper cervical. Now, jaw away from the target side. Full cervical flexion. And nod. And then relax, okay? Very intense, pretty challenging to do because you have to focus on keeping all those pieces of the sequence together. Now, I didn't say this at the beginning. This is very important. If you happen to feel a stretch sensation, some people will, some people won't. Some people will feel this at the base of the skull and even into the skull because technically it is also a mobilization for the cranium. Okay, because it will put tension on the connective tissues around the cranium. So you might feel it in weird places. Some people report feeling it in the face. It also happens to mobilize the facial nerve. You might feel it in strange areas around the cranium, base of the cranium. That's all fine. If you happen to feel any kind of stretch sensation like that, some people will actually feel it more localized to where the trigeminal nerve is, around your jaw. If you feel anything, you want to keep that sensation very gentle, 3 out of 10 on the scale in terms of the intensity. Do not go higher than that. Some people just have a tendency to want to ramp up the tension because they like to stretch and they like to feel things. Don't do that. The intention here is to be super gentle, and being gentle will probably give you the best result. All right, now, we just mobilized the right side. Let's do the same sequence targeting the left side. Okay, because I know it can be difficult to kind of learn something this technical when you're watching it on screen. So let's set this up on the left. So I'm targeting the left side. The beginning part of the sequence is the same. I lengthen up, I tuck my chin, that's the upper cervical flexion. Now I laterally flex, in this case to my right. I'm going to take my jaw, I'm going to glide it to my right, and I'm going all the way, by the way, with the jaw. And now, full cervical flexion. I get to end range and nod. Okay, try to stay relaxed, breathe as you're doing that, and you can just come out of it gently. As I mentioned, there are different ways to drive this nerve mobilization. We went over the one that is mobilizing from the upper cervical spine, where we do the little nodding motions, and that's a great place to start. Now what I'm going to show you very briefly here is how you would drive this mobilization actually moving the jaw. So it's a little bit more technical, demands a little bit more motor control. I'm going to get into the position targeting my right side, and then what you're going to see me do are jaw lateral glides. Okay, and so for the right, I'm going to be moving my jaw towards the left, and then the driver part is going to be moving it back and forth. Okay, and that's going to be mobilizing the nerve as I'm in the tensioning position. So here we go. Lengthen up. Upper cervical flexion, lateral cervical flexion, jaw away, full cervical, and now jaw glides. Okay, really pretty simple, but challenging because you have to hold all those pieces together and then coordinate the jaw. You should be moving pretty slow. Certainly don't move into any pain, and just use a range of motion that feels comfortable for you. You don't have to necessarily go to end range of motion if something doesn't feel good. If I were to do that on the other side, it would look like this. Okay, and I should add just one more thing here. When you are in the tensioning sequence and you're either making the nodding motions or doing the jaw lateral glides, the idea that you want to kind of have in your mind is that you're improving on the position the whole time. So as I'm gliding, I'm still focused on maintaining a solid upper cervical flexion and a solid lateral cervical flexion and a solid forward cervical flexion, because if I lose any part of the sequence while I'm driving it, it actually takes tension off of the target nerve and it can be less effective. So you do have to kind of play around with it, practice it, get used to it, and as always, just kind of gauge it by how it feels at first and choose your range of motion based on comfort. There's no need to force anything, and remember that rule that we use with all of our neuromechanic drills. You want to maintain an intensity in terms of the stretch that you feel of a 3 out of 10. There's no need to go more aggressively than that. Compared to what we've already done, this last part of the routine is actually going to seem pretty simple compared to the jaw stretch and the trigeminal nerve glide. It's not nearly as technical. Basically, what we're going to do here is some training. We're going to do some work that trains the motor control of our jaw. We've done the stretch, we've done the trigeminal nerve glide, and hopefully if those things assessed well for you, it's opened up potentially some pain-free range of motion in your jaw. And once you open up range of motion and create that kind of result, what you do next is really important, because you should then go and train that range of motion and train your brain to be able to own that range of motion. If you're somebody that's been in pain, your jaw has been causing you pain, it's really important to prove to your brain that you can actually execute pain-free repetitions. And that's part of the process and the practice for decreasing threat and getting long-term results over time. So we're gonna do some motor control work. Here's how it works. Lengthen up nice and tall. You can take your fingers, place them right on your jaw, right at the joint, and bring your teeth apart slightly. And all you're gonna do is take your bottom teeth and slide them forwards all the way as far as you can. And then you're gonna slide them back. Okay, so I'm working on this plane, sliding forward, sliding back, all while maintaining that long spine position. And you're going to do that roughly 5 to 10 times with the goal of moving very smoothly, right? You don't want it to feel ratchety at all. Sometimes people will have like gaps in the movement where their jaw wants to jump. And those gaps are areas where you don't have good motor control. So then what you want to do is slow things down and really focus on that particular part of the range of motion so that you can build a map for it. So those are our forward-backward glides. Now, same start position, lengthening up, we're going to take our bottom teeth and we're going to glide them side to side, similar to what we did as a driver for the trigeminal nerve glide, although now more focus on full range of motion. So now I slide left as far as I can. I slide right. Okay. As I'm doing that, I'm focused on, again, making a smooth movement. If I feel any of those little ratchety spots, I want to slow down and really take the time to map that area. Maintain a nice long spine as I do it, and try not to build up facial tension. Sometimes people have such lousy coordination when it comes to their jaw, it's very common, that all of a sudden they're moving their eyebrows, they're blinking, they're making all sorts of funny faces. Over time, you want to be able to get rid of all that unnecessary movement and make this super isolated to the jaw. So this is kind of the training that comes after the first two drills. Take your time with this. 5 to 10 repetitions, 1 or 2 sets is perfectly sufficient for these particular motor control drills. All right, there it is. 3 really high percentage exercises to hopefully help you with your TMJ issues. Remember, assess and reassess to discover which exercises are the best ones for you. If you get a good result from any exercise, then those are the ones that you want to really prioritize and focus on. If one exercise is not assessing well for you, then just, push it out of the way for now. We want to locate those high payoff drills. Remember what I mentioned, every person is different. Not everybody responds equally to the same stimulus. That's why we have the assess, reassess process to really help guide you so that you can figure out which drills make the most sense for you and your brain and body's needs. So that's it for today. If you are digging this kind of content, applied neurology and learning about all of these cool tools that we have to help with these different pain issues and movement issues, then let me know what you're looking for in terms of content. That would really be helpful to me, and I'll be sure to consider it when I'm figuring out what's next in terms of our next video. If you like this video, please give it the thumbs up. If you haven't done so already, subscribe to the channel because it really helps. And as you're going through this routine, if you have any questions about it, please let me know in the comments because I'd love to help you out. That's it for today. See you next time.